Dr. Okema, thank you so much for talking with me today. You are known to be an ethical hacker. You are a renowned data analyst. And I interviewed you, gosh, it was probably last year. I've interviewed you a few times.
Yes.
And you exposed, well, you showed the audience in your sort of, you came up with a software where you improved a software that was able to download all the files on EMA's, European Medicine Agency's Vigilance system.
Yeah.
And you were able to sort of amalgamate all those files and present it in a way where the public can see what is already on the system, but you're doing it in a very sort of easy to see, to navigate through all the data points and to see all the adverse events.
Public data points.
Yes, the public data points.
Yes.
Okay, yes. Now, based on that, could you tell me what has been the repercussions for you on the back of that? The fact that you've made this data accessible.
Mm-hmm.
I'd like to know what has been going on with you.
Yeah, I think that, repercussions, I didn't have repercussions in the sense that it was hurting.
Yes.
I had wonderful conversations with Dr. Malone, with Dr. McCullough on that public data that I gathered. And so the result, in fact, was fantastic. It was very positive, very inspiring. And in my talk with Dr. Malone, we at some point came to analysis where Malone inspired me to take it to a deeper level. And as a consequence, through a crowdfund, I was granted a mini mainframe that enables me to do that analysis.
Right, yes. Well, that's brilliant. And so could you tell me a little bit about your website, the tableau that you've put together with these dashboards? What can people see when they go and access it? What can they,
Yeah, it is the EMA public website called Pharmacovigilance.
Yes.
It's their pharmacovigilance database. It does not allow people to get a holistic view of what is going on in terms of adverse event reporting on medication.
Right.
Because the EMA website is designed to look at one particular medicinal product only.
I see.
I think the power of the dashboards that I present on Tableau is that it shows the reporting on all 6,000 different medicinal products, substances, vaccines, including the COVID vaccine.
Yes. And what was the key finding on the COVID shots? Because that was quite remarkable what you were able to find.
Yeah, I think the most shocking finding is the most reported adverse event for the COVID jabs was COVID-19.
Yes, but also to do with the how many times more the adverse reports were for those shots, as opposed to all the other drugs and vaccines over the past 2 decades.
Massive. And on one hand, that makes sense, of course, because so many people were vaccinated.
Yes.
But also, if I look at the statistics, how many people use medication in general, you easily get to 75% of the total population. Yeah. So yes, of course, there is an explosion of reports of side effects, not only in Europe, but also outside Europe. But on the other hand, there's also been massive amounts of people being vaccinated.
Yes, yes.
Yeah.
Now, the database that you have, that you've collected, all from European Medicine Agency's Vigilance system.
Yeah.
Now, how has that helped individuals, patients, people who have been maybe suffered an adverse event? What can they do when they go on to your site to make,
So one of the dashboards is called a case locator.
Yeah.
You have to imagine that if a patient or a family member or a doctor submits a case of adverse events to the national competent authority, then this national competent authority needs to code, to classify, to code, and to characterize all the items in the case, and then they forward that to the EMA database. It came to my knowledge that with patients that I spoke to, and including a case that I filed myself on behalf of a family member, the processing, the sequence of processing resulted in the case that I filed being not properly categorized in EMA.
Could you give me some more details on that?
Yes, so my family member was hospitalized with an acute pancreatitis.
It is after taking an COVID mRNA shot?
That is correct.
Right.
And so there was, he's been through all kinds of diagnostics, and the specialist, the hospital specialist doctor came and said, well, it is my thinking that this could be a side effect of the COVID vaccines. As a matter of fact, I have 3 other patients in my practice with exact same diagnosis where I think I see a correlation. So I filed a report on behalf of my family member to the Dutch LAREP, the Dutch authority. And because of all my research into the EMA database, I was able to locate this particular case and noticed that it wasn't marked, seriousness was not marked as hospitalization, but as other, which is far less serious, if you will.
So that's quite key. So you're saying that when you went to double check using the identifier number, just to make sure that the case report was, accurately, I guess, logged in, all the information, the details, that critical point, the fact that your family member was hospitalized was missing, was omitted from the report, right?
So what I did, Sonia, is I reached out to the Dutch authority, LAREP, and asked them, am I correct that this is the case that I filed? Yes, that is correct. Question number 2, I have specified in my submission that my family member was hospitalized. I don't see that back in the EMA case. And then LAREP responded to me that, so I made a mistake, not they, I made a mistake, but we will correct it.
How did they say you made the mistake?
They didn't specify that.
Okay.
Anyway, what happened?
So they didn't believe you. So they didn't essentially believe the fact that they had omitted the fact that your family member was
probably, and I don't know. I think what is most relevant is the fact that the LAREP, the Dutch LAREP.
This is the Dutch authority. This is the
that does the processing. They told me that we will correct it.
Right.
So you should be able to see that in the EMA systems in a couple of weeks.
Yeah. So would you say that what you have put together with your team is a beneficial tool for patients, for anybody who has been injured by
or patients or pharmacists or doctors of these patients? It depends on who files the case. Yeah. I filed it as a family member.
Yes.
But a doctor can file a case as well, obviously. And so if they want to, they are called in official the reporter. Yeah. So if the reporter wants to check how their submission ended up in the EMA systems, they can use my dashboard, the case locator, to find that.
Right. Yeah, it's a very important tool to verify, make sure that the records match up, making sure that the details are all there, nothing is missing. And like you said, in your case with your family member, there was a key detail that was missed. Now,
I see, if I may, Sonia, of the people that reached out to me, there were dozens of people who found out that their case was not properly registered.
Right.
Dozens this
that
ranged
you know
from side effects missing, not being recorded,
right,
to who reported it, a healthcare professional or a consumer, a patient.
Yes.
Sometimes a doctor reported, but the case was classified as reported by the patient themselves. And you have to be aware that within pharmacovigilance, a report by a doctor has more value than a report from a consumer.
I see.
Yeah. So this is all kinds of errors that came to surface because of this tool. And
would you say then that a lot of key safety signals have been missed or overlooked because of certain sections being?
No, I cannot judge on that.
You're not sure. Yeah, okay.
I don't know how. I know the algorithms that are involved in safety signal detection, but how they are, let's say, evaluated by the commissions and the experts at EMA. I'm not a doctor. I don't know how that works.
Yes. Okay. So now moving forward, so now we are at this, we're in the Netherlands. It's lovely to be here. We're at the Back to the Future conference where you are one of the speakers.
Yes.
And you will be speaking later this afternoon. Could you tell me recently what you found in your inbox a few days ago?
Yes, I can do that. Would it help if I first tell a little bit of what I did?
Absolutely.
And what I'm going to present about. So where 2 years ago I wrote a tool together with a brilliant developer, Twan van der Poel. I wrote a tool to download all the public data from the public website. Last year, December, I stumbled upon a publication by two French scientists from Marseille and Montpellier, and they published a Python script, a piece of code, a tool, because they in what they wrote, in what they described, they shared the same, let's say, frustration that I had with the complexity of accessing ultravigilance data, and they wrote a Python tool to quickly download everything that they wanted. I took that code and I've expanded that into a generic, I call it an Oracle query data collector tool. And in doing that, I used the same method that the scientists did and was able to download data from the EMA.
And how much data were you able to download?
A lot. There are millions of cases in EMA, so it's big data, and that is my expertise. Mm. It is based on that effort that I was able to develop a case locator for people that report side effects. Yeah. In this conference, my plan is to share the patterns and the insights that I find on that data. The beauty of this conference is that we're going to have medical specialists in the audience. I'm not a medical specialist, so although I can reveal patterns and analyze patterns and show that insight, I cannot interpret what I see because I'm not a doctor.
Yes.
So during this conference, I plan to have an interactive session with the audience and to see if we can gain knowledge from what we see. Yesterday, I was about to step in my car to drive to this location and needed to look up the address, which I believed ended up in my spam folder. So I went through my spam folder and stumbled upon an email a big email that the European Medicines Agency apparently sent me a week or two ago.
And you have it here.
I have it here.
Yeah, this is your letter.
So it's a very lengthy.
Could you summarize it for us?
Yes. Well, I will read the subject.
Yes,
I will read
key
the subject.
points.
Dear Mr. Aukema, subject: request to immediately delete non-public information originating from the Pharmacovigilance system and made available on the dashboards you have on Tableau Public.
Wow. So this is the European Medicine Agency asking you to delete the data you have on your dashboards.
In addition to getting rid of these dashboards, the EMA is also requesting, I don't know the proper wording, urging me to delete all the data that I've collected over the past years, and to make sure that any third party also does so. I don't know how they want to make me responsible for third parties, but so basically what they're writing in this letter is that this unique identifier, the worldwide unique case identifier, apparently, according to EMA, indirectly may cause a risk to identify individual patients.
Right.
I personally, I don't see how, but that
Yes.
for me is not important right now. I understand and I respect that EMA is apparently concerned.
Right.
So as a consequence, and it is not only the worldwide ID that they are concerned about, they are also concerned about the country of residence data that I apparently collected.
Just to stop you there,
yes,
because
yes.
the data you've collected, are there any patients' names or date of births on any of the reports, the files that you've downloaded? Anything to lead back to the patient?
I don't know, because I operate a little bit in a black box, if you will. I have no system documentation, and I can confirm that I have no access to patients' birth dates,
yes.
or
there's
things
nothing
like that,
to
or
trace,
names, or
to trace back. No address, no name, no date of birth.
No. And to be honest, even if that data would have been available, I would never have downloaded it, because that is not the objective.
Yes.
My objective is not to
find
people.
Absolutely.
My
yes.
objective is to gather insights on patterns in this massive amounts of reports.
So the data anonymization is still intact, essentially.
Well, not if you ask EMA.
Yes,
because
but
otherwise
EMA
they would not have sent this email.
Yeah.
Basically, what EMA is telling me, that I need to delete everything, but also that I need to, how you said that, refrain from any communication on whatever means. As a consequence, I need to dramatically change my presentation today.
Yeah. See.
And because I respect their concern, regardless whether I agree or not, that is not the question today for me. I simply respect their concern. Therefore, I spent until 4 o'clock this morning changing my slides and redacting them in such a manner that I won't share these details with the audience.
Would you say that the European Medicine Agency essentially is censoring you, censoring your website, silencing you?
Well, yeah, I would say of course, but You know, Sonia, when I got that email yesterday, of course I was shocked.
You were shocked.
Because it comes across as a form of legal pressure.
Yes.
And as such, my initial reaction is I'm being censored. Yes, of course. Yeah.
Yeah. And isn't it interesting, because doesn't EMA pride themselves on their transparency for their data, the fact that they have this huge vigilance and it's accessible to the public?
You know what?
Yet they don't want this data to be accessible to the public.
Exactly, and there is such a...
So is there double standards going on here?
What I'm going to talk about, one of the things that I'm going to talk about is the enormous difference between the US pharmacovigilance systems, like VARS for the vaccines, and the FDA, CDC one, etc., where apparently they have no privacy problems to the excessive extent that we have in Europe.
I see.
I do not understand why I'm not allowed to know whether a patient came from Germany, Poland, or Holland.
Yes.
Whereas in the US, they have no problem to share the state of residence.
Yes.
The entire case narrative is shared with the audience.
Yes.
Etc., etc.
So that's what they seem to be most concerned about, is that you're revealing through these identifier numbers the country of origin of these reports.
Exactly.
Okay, you're not revealing the patient names, you're not revealing
I can't, because I don't have it.
You don't have access.
I don't have it.
So it is just baffling how they are saying that you are exposing, or there's a risk of the patient being identified just from the country of origin.
Yeah, what they refer it to in legal terms, because I believe it is written by a lawyer, this letter.
Right.
What they make a distinction between direct and indirect risks of privacy violations.
And they're including indirect as well, aren't they?
Yeah, they refer to this data points, country and the worldwide ID. They refer to that as it could indirectly lead to the identification of a patient, which I don't see that, but we'll figure that out later.
Right, so you've had to basically change your entire presentation just very last minute.
Yeah.
And you are, I mean, essentially, would you say you're being bullied by EMA? Legally bullied?
That's a very interesting question, Sonia. Back in September 22, I had an interview on a Dutch YouTube channel called Blackbox, BLCKBX.tv, about my research into the EMA data, public data. And one of the things that I discussed was the disappearance of large amounts of cases over time. Every week I was no longer able to identify a large portion of the cases. And
did they go just missing? The number just wasn't there anymore?
With the public knowledge, as a public visitor, my conclusion at that time was that there's a lot of cases that end up missing. And this is what I shared on this
As a percentage, program. Would you be able to...
40% of serious cases.
Wow, of the serious cases. I think we
But hear me out, please, hear me out. What happened is that the journalist who interviewed me had sent out some questions to the EMA, and the press office of EMA responded in public and accused me of misleading allegations.
Misleading allegations.
Misleading allegations. What EMA did not do is to educate or inform me or the public about what mistakes I would have made.
So they didn't correct you? They didn't say where you've gone wrong?
No, they just accused me.
accused you of misleading allegations, of essentially lying, right? Misleading allegations is not telling the truth.
Different way of saying it. So, coming back to your question, do I think they are bullying me? Well, with such a reaction from their press communication office, yeah, Sonja, what am I supposed to think? Yeah. End of conversation. And this is a pity, because during that interview, I said, let's sit around the table and let's work it out. Right. Obviously, that didn't happen. Now this letter happens, and it's a legal letter, and if I don't comply, then obviously they're gonna take it a step further.
You're worried about what the aftermath will be, right?
Of course. So in that sense, am I being censored? Yes, silenced. Yes. But let's work it out. I mean, I am not causing a privacy concern. The dashboards that I offer are of only use for the patient or the doctor that reported. If I report a case to the Dutch authorities, I get this identifier as a confirmation number, if you will. You have no knowledge of that number, so what use can you make of that dashboard? No use at all.
Yes.
Because you don't know my number.
Exactly.
Yeah. So I don't see the concern. But EMA has a concern, fine, let's talk about it. So what I did yesterday, I was obviously upset when I read this, and it never happened to me before. So I wrote them back a quick email, because I was in a hurry to get to this location, and I basically said to them, okay, I received your email, it ended up in my spam folder. I will respond to you back in 14 days.
Right. What do you think? I mean, they're giving the pretext that they're worried about patient, being revealed, being identified from what your database is showing. What do you think the real reason is? Obviously, you are not the European Medicine Agency, you're not a representative of that agency, but what do you think their fear is about what your data sets coming from them? I mean, it all stems from Pharmacovigilance. What do you think what are they so afraid of?
If I read the letter, it's all about privacy concerns. I'm more than happy to have a debate with them on that. Yeah. Whether they have other reasons, I'm sorry, Sonja, of course I have my thoughts.
Yes.
But let's stick to the facts and let's discuss it.
Yeah. So you want to have a fair, open discussion with EMA. You're willing to work with them.
Of course.
Yes.
And I think I show my goodwill by redacting my presentation.
So you are going to redact your presentation?
Yes, and I will announce to the audience that I've done so.
And
by
the reason
showing
why.
And by sharing this letter, if I'm sticking to the facts.
Yes.
EMA is writing in this letter that reproduction is authorized provided the source is acknowledged. So I'm going to give you a copy of the letter, asking you to not reveal the name of the one who wrote it.
Yes.
Obviously, and then my first focus is my presentation today. I needed to change it dramatically. I need to also inform my public in advance why, and this is the reason why.
Yeah, okay. Well, thank you, Wouter. Thank you for sharing, with me today. Is there anything else you want to add, or what do you want to let people know, the audience know? Anything else? Feel free.
We live in strange times.
We do. We do live in strange times.
Sometimes it's difficult to I say that, remain rational.
Yes.
Yeah.
Yes. Thank you so much.
Thank you too, Sonia.